our COVID press briefing for this week to talk about the situation here in Cole County. I'm Christy Campbell. I'm the director here at the Cole County Health Department. Our current information is listed on the website. We're still adding cases by test date. Our cases are still elevated but seem to be stable. Anywhere from 18 to 56 people are testing positive each day for COVID. And then we're going to let the hospitals talk about the situations they're seeing and reinforce the testing and vaccine locations that they have available. So we'll start with Dr. Barg from Capital Region Medical Center. Thank you for joining us, Dr. Barg.
Yeah. So we're continuing from a hospital perspective to see high volumes within our hospitalizations. Hospitals are busy, they're full. And probably about 25% of our hospital census is currently COVID-related admissions. We continue to see a high volume of patients seeking care both through our emergency departments and urgent cares. One thing that I would certainly like to share with all folks who see this is that I think this current surge is very different than our previous surge in that your primary care physician is a resource for you from a testing perspective. You know, previously we didn't have testing across all of those care locations at the front end of the pandemic. We largely have that testing available in clinics pretty much across our area. We have a few locations and we're assisting those folks to help give them a testing resource for their patients. And so I really want to make the ask of the community to, if you have a primary care physician, that first place, if you have mild symptoms or you've had exposure, should be a call to your PCP, really to help you through what the process needs to be. And the urgent cares, it's incredibly busy. Some of those wait times are exceeding an hour and a half to 2 hours. And I think that many of that excessive wait could probably be headed off by utilizing our primary care providers more. But in addition, we recognize that there are people across the community that don't have an established primary care provider. For those people, we do have a triage line set up at Capital Region that you can call. I have that triage number if that's effective. That number is available Monday through Friday from 9 to 1. And we ask that if you have a primary care provider, you access your primary care provider. But if you don't, please, by all means, contact that triage line, particularly if you have mild symptoms or you've had exposure and you just need some direction with where to go. And I think that probably the last thing that I would want to mention is that the most important thing at this point is that if you're well and you haven't been vaccinated, get vaccinated. If there's anything that we recognize across the folks that we are seeing admitted is that there is a marked difference in severe disease for patients whether they've been vaccinated or not vaccinated. Those unvaccinated people are largely the volume of patients that are filling our COVID beds at this point. So I would encourage folks to get vaccinated if they have not been vaccinated.
Thank you, Dr. Barg. Do you want to drop that triage number in the chat? That way you don't have to read it off and everyone can just look there for it. That'd be great.
I'll do it.
Okay. Dr. Adams from St. Mary's, thank you for joining us.
Thank you, Christy. Sorry, my computer did not want to join for some reason. Today, we have 37 patients admitted related to COVID. This is the third highest day for us since the pandemic has begun. So just to bring home the point that we are certainly in a surge that is completely comparable to the previous surge that we have been in. We have had to reschedule some surgeries, and I want to reassure you that your hospitals are collaborating on a daily basis to make sure that we are utilizing the resources that we have to try to get everyone's healthcare needs met. We've been talking with Capital Region every day, and if we are unable to do a surgery here, asking if they could accommodate the surgery, and so far that is what we have been able to do. So I just want to thank them and the community. We are all thankful that you have healthcare leaders in this town that are collaborating to bring you the care that you need. Also, I mentioned previously, we have added more than 24 staff to meet the capacity needs of our community. And next week, we will be adding additional staff as well. Thank you, Christy.
Thank you, Dr. Adams. Dr. Sullivan from the Community Health Center of Central Missouri.
Good afternoon. I wanted to update everybody on some mobile vaccine clinics that we have scheduled in the upcoming weeks. So we have partnered with several local schools to provide vaccines to anyone 12 and older. Last week we were at Jefferson City High School, Capital City High School, Thomas Jefferson, and Lewis and Clark. Yesterday we were at Lincoln University. We'll be at Helias tomorrow, Friday, August the 13th from 12 to 3 p.m. We'll also be at the Parks and Rec back to school event this Saturday. And then next week we'll be at Blair Oaks on Wednesday the 18th from 5 to 7:30. Again, these vaccines are free and available to anybody 12 and older. We're also continuing to do testing and vaccines in each of our clinic locations. So if you'd like testing through us, just call our office. I also wanted to just add that COVID testing is also available at some of the local pharmacies. So I know Walgreens and Hy-Vee have testing available, and you can find out more information and sign up for testing through their websites. So I know they had some weekend availability too. So if that's somebody's needing over a weekend, that's an option. And then the state is sponsoring a free testing event on August the 22nd from 11 to 7 at the American Legion. That's all that I had. Thanks.
Thank you, Dr. Sullivan. So for clarification, the events at the schools like Helias and the back to school event, those are open to the public. You don't necessarily have to have a student at those schools to be able to come and get a vaccination.
Correct. They're open to anybody 12 and older, parents, grandparents, siblings, anybody in the community.
Great, thank you. Dr. Robbins from Jefferson City Medical Group.
Sorry. So yes, we've had about 378 symptomatic tests in the last week, 118 positive, and that's a 31% positivity rate. So still awfully high relative to what we were seeing, of course, just a few weeks ago. We are trying to encourage all of our patients at JCMG to get vaccinated. Over the last week, we've given 475 vaccines. So that's a large increase compared to what we had been giving for a while. So I think more people are seeing what's going on in the country. And fortunately, I think we're getting those that were on the fence to be more open to getting the vaccine. I've tried with my patients to just take a very soft approach and just respectfully ask those that haven't been vaccinated, why not? And, you know, what's the information? Where have they gotten their information from? And then just try my best to talk to them about the scientific data that we do have. And it's surprising, you know, when you approach people like that, you're going to get a lot more people that are going to at least consider getting it than, of course, if you shake your finger at them. So that's been pretty successful for me personally, and I'm sure a lot of other physicians as well. So I think that continues to be our message: is please get vaccinated. The more people that get vaccinated, the faster this thing is going to go away, and the safer we're going to keep our patients, our community, our loved ones, our friends, and so on. That's all I have.
Thank you, Dr. Robbins. Commissioner Bushman, do you have anything to add for the county?
Well, at this time, Cole County is still not prepared to issue a mask advisory or mandate, but I know there's businesses and stores in town that ask you to wear a mask, and so you can wear a mask when you go in there, or if you're uncomfortable in a gathering, then by all means wear a mask. I think we need to go back to the hygiene of them, though. The cloth mask, you aren't supposed to wash them after every wearing. And disposable masks, you see people hanging them over their rear view mirrors. Those are made for one-time wear. So wearing a dirty mask isn't gonna help anybody. So that's just kind of a something we need to maybe go back and think about when if we are going to wear masks again.
Thank you, Sam. Yes, we've been still trying to emphasize the importance of social distancing, washing your hands, staying home when you're sick. We know that the vaccine definitely protects against severe illness, but there is some asymptomatic spread with vaccinated individuals or mild symptoms. So we want people to be aware of that. And if you start to have any symptoms, to stay away from others and to isolate and get tested if appropriate, contact your PCP for their advice. And I also want to, last week we talked about the importance of, building your immune system and vitamin D and C and zinc. And today I wanted to emphasize that travel continues to be a high risk activity for contracting COVID. You're around a lot of people that you're not used to, you're going to different places. And when people return from travel, they need to really watch closely for signs and symptoms and stay isolated from those that are vulnerable until they've been home a while and know that they haven't contracted COVID while they were gone, especially if you're traveling to those high risk destinations. I know Florida has been in the news quite a bit lately. So just to be aware of your surroundings, and even when you're on vacation, practice those good practices of keeping your distance, washing your hands, wearing a mask if you're in close contact with others. So just keeping up all those good measures that really worked for us last fall, and they've kind of slid a little bit, and we need to dust those off and bring them back out again. So at this time, I'd be happy to entertain, or our panel would, any questions from the press.
I have a couple of questions. One of them is a little bit more of a general one, so I'll direct it to you, Christy, but anyone can answer it, and there may be a better person to ask. That question is just that anecdotally, when I've spoken with different health officials, it seems like they all say that they're facing similar shortages in supply and staff and things like that. And the state's response to that has been, well, we've got all these supplies and we've got this Vizient contract, and that's the response, is the tools are available, the resources are available, but hospitals just don't seem to want to take those resources. Is there a roadblock in between those two that hospitals are facing that leads them to not take the state's resources that we're just, as the press, not seeing? Does that make sense?
I understand your question. I think that would probably be better for Dr. Barg or Dr. Adams to address as the hospital representatives, because we haven't had those experiences here.
Hi, Michael. Thanks for your question. If you don't mind, could we maybe connect after this and talk about it in more detail?
Yeah, absolutely. I can shoot you an email.
Thank you.
Appreciate it.
Did you have your second question?
On that note, I'll ask my second question, which is actually directed towards Dr. Barg, if possible. That I spoke this morning with a nurse from Capital Region who was talking a little bit about the mental health effects that she and other nurses, she says, are going through working through this surge in COVID cases. And she compared it to being like a war zone, that it just every day seems like a battle to her, and she has nightmares and lack of sleep, and that things are just so harrowing there. So I was just curious what Capital Region offers as far as mental health resources, as well as just what general protections nurses are being provided with.
Thanks for the question, and I think that this is an important thing. I think everybody on this call and certainly on our collaboration calls, we have conversations about. So from a Capital Region perspective, so we have actually deployed some of our clinic mental health resources actually to the floors to be able to assist in real time to help some of these folks through a lot of what they're having to manage and deal with daily. We also have offered additional EAP opportunities for those inpatient nurses and those staff that are continually affected by this. And certainly our long-term desire, as we are all dealing with staffing shortages, is really to help give them some reprieve away from just the schedules that they're having to endure at this point. But we also have a robust wellness program at Capital Region, and continue to have additional resources that come together from folks across our staff. We have a Thrive team that's made up of various members, and those people are there really from a burnout perspective to help and engage with our staff and try to help them through this challenging time.
Thanks, Dr. Barb. Appreciate it.
Are there any other questions at this time? Okay. Well, hearing none, thank you all for joining us today. I hope you found the information useful, and please reach out if there are any more questions. Thank you. Have a good day.